Recently, a two-day event, Healthcare Convention, was organized at Hotel Hyatt Regency, New Delhi. The Healthcare Convention 2015 brought together experts and leaders in the healthcare fields from India and abroad. They discussed the challenges faced in the industries, their solutions, and the impending rise and growth of the industry. The event saw a large turnout of visitors and experts. Dr. Lalit Bhasin gave the welcome address to all the delegates.
We have a very interesting program today, very informative, useful. There are so many expert speakers today who will be deliberating and discussing on various issues which concern the healthcare sector. And I am sure that the proceedings would be useful. Thank you so much.
The first session of the event started with a panel discussion on the macro view of the health industry.
We start the first session, which is the macro view about the Indian healthcare industry. Healthcare has three things to achieve. It has to be affordable, it should be accessible, and it should be quality.
How do we make our system to be effective? Because so far what's been done has been done with entrepreneurship zeal by doctors opening up their clinics or hospitals and to fill in a business need or a consumer need as they felt fit. Whatever the private sector is doing over here is going to be complementary to what the government is trying to do and help the government in reaching out to the poor people, not only the poor, all the people I would say. Then we've done our job.
See, overall, it doesn't matter whether government or private. Who is our customers? I wouldn't call them as patients. Health consumers. How they've been treated in both in private segment as well as in government segment. I see no difference. Today in a corporate hospital or in a government hospital, these health consumers are treated in the same way.
And if I'll talk about hospitals ranging from 0 to 50 beds are by default in tier 2 and tier 3. Now everybody who is targeting even the big daddies, for an example, the big healthcare giants are heading towards tier 2 and tier 3. So we have to identify how we can enhance the medical skills.
There was a question answer round where visitors showed their great enthusiasm.
I think one of the panelists spoke about getting the government out of certain things. I don't really agree with that. You need to have some kind of regulatory body. You cannot keep the government out of it. It has to be there in some form or the other. Maybe there has to be a little more partnership or understanding or meeting between the government and the private healthcare. But some kind of government involvement in healthcare has to be there, and that's the only way to ensure that health for all is achieved.
Nobody talks about taking the government out of it. It is an inclusive and not exclusive agenda for the nation. That's number one. The second thing is that the accountability, whether it is private or government, should be the same, which is not there. That imbalance has to go.
Here is what Dr. Giridhar Gyani has to say.
We are absolutely poor on regulation. But sadly, I will say, the healthcare, you will be surprised that there are states in our country where hospitals are registered under the Shop and Establishment Act. I am talking of Gujarat, where these hospitals are registered under the Shop and Establishment Act. And if you treat the healthcare like this, I can assure you that we will not be able to achieve what we have been talking in the opening session.
Many important delegates participated in the second session of the event.
So I'd go to start the discussion off with one of these, Dr. Das. What do you think is the scope of digital health, and how strongly can it actually bring benefit to healthcare delivery in terms of the triad that we spoke about?
The answer is digital health is anytime, anywhere healthcare. Something which is available to you by whatever you have. It could be a set-top box, a mobile phone, a television, a radio, anything that can capture something wirelessly and on the go. So that was the origin of digital health, and to which the mHealth or telehealth as a piece came in when such deployments were happening on a public health level where you were touching around millions and billions of people in one go. And people realized that without technology, it's almost impossible to go door to door.
To be very honest to this audience, I think we are doing a lot of injustice with this section of the society because we have not developed the adequate infrastructure to handle this crowd.
The reality is that where is the cost structure of the healthcare business? The whole cost structure of the healthcare business is in consumables or in specialized talent, which is doctors and nurses. Doctors and nurses are in short supply. It will never be able to solve the problem. If you continue to throw money at the problem of creating more doctors, creating more nurses. So clearly the present model of healthcare where patients have to come to the hospital to get treated has to change.
The whole gamut of products come under the medical technology, starting from drugs and consumables, implants, devices, and various other products. So 70% of the technology, which is medical technology I'm talking of, is imported in our country. And there is less invasive procedure. And of course, the stay in the hospital is also shortened, ultimately reducing cost.
I think that's the balance that we need, and we need to move forward with all these things in place. Thank you very much.
Here's what Dr. Sujit Jha has to say.
Our Max Healthcare Institute, we have been delivering very focused care for last 8 years' time. Particularly, I've been involved as a director for last 5 years. And the focus is empowering patients and those who have been looked after me. If somebody is here, somebody comes to me, we can take that challenge that we empower patients. We don't treat them. We tell them, educate them, and we try our best to deliver the best healthcare. And we have started type 2 diabetes prevention study. We're just getting a final approval from ICMR.
Focus of the third session was to bring all the healthcare experts under one roof.
On the topics which precede this session, that was on the industry macro view, followed by technology and innovation, and this in a sequential manner is the session on regulatory and policy. This will highlight the healthcare regulation and policy as well as healthcare reform.
The entire approach towards running a hospital, because as we said in the presentation of AHPI, we saw that we are not talking about corporate models, big corporate hospitals where 500, 700, 1500 beds like Johannesburg Hospital we are talking about will be creating. In those hospitals, how do you maintain the documents? How do you scan them? How do you know that you treated this patient in OPD and now he is coming to your home? How do you know that you are taking the input from the patient? Rather, you are giving him the input. All these things to be reworked now, and we have to remodulate entire privacy laws where you have to guard the patient's rights and other things.
First, I'll talk about a personal opinion there. Actually, the privacy and confidentiality thing of the West and of India are not in the same thing. It has been on record when a US president had some surgical operation and some other doctor in the hospital tried to access his record, he was actually sacked. So that's exactly not the way we look at privacy or security, but nevertheless, there is definitely a need for a law.
Now, most importantly, when we are talking of litigation, medical legal cases, medical negligence, I would give some advisory from my side to my doctor colleagues about how to safeguard from litigation. Most important thing is a doctor-patient relationship. Every relationship is built on mutual faith and trust. If that faith and trust, पहले डॉक्टर भगवान होता था, आजकल डॉक्टर शैतान माना जाता है. So भगवान से शैतान, that transformation, we ourselves are responsible. We have to be more empathetic, sympathetic towards patient. So my advice to my fellow colleagues, please have a very safe practice.
So I want to touch you on two things. Well, what we do is basically we open clinics, and as Professor Gupta was telling, that we take people of 3 to 5 years experience, put them through a training program of 2 years, and get them certified by the UK Royal College. But what is most interesting is that how we pay our doctors. We have a system of doctors' fixed pay and a performance management system which has come up with a balanced scorecard. And I think that is a unique, which we have taken from the industry. So I think this is very, very important when it's come to regulatory.
We have produced such a good product in the form of the presentation made by such eminent panelists here. I think they deserve a special applause. Thank you.
In the fourth session, here's what the experts had to say.
So we'll start with the first speaker, Dr. Sushil Kumar Meher.
Of course, this is IT in healthcare. It is a most challenging issues in the healthcare industry. When we want to computerize a hospital, right now people are talking about smart hospital. Somebody is talking about the paperless hospital. So all these things are available, but thing is that how to go for. And when we talk about IT investment is a very huge amount of finance is required. And getting the finance to make a smart hospital, it is a big challenge for the IT department.
I think first time we are, the discussion about IT is really, becoming a very hot topic. So I'll just build on top of what you mentioned, sir, that for example, human resource. We don't have enough doctors, we don't have enough beds. So when you allow a model which is like a Uber model, taxi for sure or Ola, all of a sudden you define a process by which a human resource who is not that well trained can already contribute to the system.
I would very proudly say that perhaps this is India's first comprehensively digitally smart hospital. We've partnered with IBM. So a typical example of a trauma patient coming into an ER, a doctor routinely is informed that the patient has crashed, ambulance has gone, is on the way. Now the ambulances are empowered to actually give the data in real time to the doctor who's changing his track pants, wearing a trousers and running to the hospital.
I think it's really been a very stimulating discussion so far. So his query is whether it's economically feasible to start a 100-bedded hospital, smart hospital. And if so, who should be approached?
Wonderful. Completely feasible. I think hospitals don't make money because of poor administrative skills and poor wealth management. Poor administrative skills and wealth management. Wrong resources, wrong pricing, and unable to drive a complete utilization either of space or of the manpower. In India, the way forward for a 100-bedded hospital best is a specialty hospital.
Many delegates from India gave their view.
So this convention is about how to bring patient care to the next level and also how to bring the ecosystem together in order to improve the patient care.
Thank you that you are covering this and इतने ज़्यादा लोग ये देखेंगे, सुनेंगे, healthcare की awareness होगी, plus जो general public है sensitize होगी towards healthcare, plus government को reach out करना, तो काफ़ी जो सारे stakeholders हैं, different partners हैं, वो इकट्ठा काम कर सकेंगे.
इस संस्था में जो बात हो रही है आज कि हाउ डू वी प्रोवाइड यूनिवर्सल हेल्थ कवरेज टू द सिटीजन्स ऑफ इंडिया.
ऐसे लगता है कि हेल्थ केयर सिर्फ जैसे अमीर लोगों का उनका एक है, पर गरीब लोगों के लिए जो कि मेडिसिन नहीं अफोर्ड कर सकते, जो इतनी अच्छी डॉक्टर्स की ट्रीटमेंट अफोर्ड नहीं कर सकते, उनके लिए कुछ भी नहीं किया जा रहा है.
टेक्नोलॉजी में हमें चीज़ें जो हम बाहर से इंपोर्ट कर रहे हैं उसमें हमें कॉस्ट एक बहुत बड़ा फैक्टर है जो हमें जिसमें हमें मुश्किलात आ रही है. उसके लिए हमें ये देखना है कि हम ऐसी क्या चीज़ है टेक्नोलॉजी में जो हम इंडिया में प्रोड्यूस करें ताकि हम टेक्नोलॉजी को दूर दूर तक पहुंचा सकें.
And essentially the reason we wanted to do this event is because there's a huge gap and need in the market to ensure that, like healthcare and wellness is actually treated as a priority in terms of industries.
The first day was a grand success. This event to be continued in the next part.